Have you ever heard that menopause is a natural stage of life, but one that often arrives with unexpected and challenging changes? Among them, vaginal dryness is one of the most silent symptoms, yet one of the most impactful on a woman's health and self-esteem. And here's a surprising fact. Up to 80% of women in menopause report experiencing vaginal dryness, but most of them never talk about it, either out of shame or because they believe it's normal to suffer in silence. Today, I want you to stay with me until the end, because beyond understanding why this happens, you'll discover practical solutions, prevention tips, and even modern strategies that can completely change your experience and help you regain confidence and vitality. And let me tell you, there's a very important part that almost nobody talks about when it comes to intimate health during menopause. And I'll reveal it later, so don't click away. When we think of menopause symptoms, the first things that usually come to mind are hot flashes, sleepless nights, mood swings, or weight gain. But vaginal dryness is just as significant, only it tends to be overlooked. And it doesn't only interfere with sexual intimacy. It can turn simple actions, like walking long distances, sitting for hours, or even exercising, into moments of discomfort. Emotionally, the weight can be devastating. Many women report feeling less feminine, less desirable, and some even withdraw from their partners out of fear of pain during intimacy. This cycle of pain, fear, and silence eats away at self-esteem and undermines confidence. But why does this really happen? The explanation lies in estrogen, a hormone that plays a vital role in natural lubrication, vaginal tissue elasticity, and even in maintaining a healthy vaginal flora. During menopause, estrogen levels drop sharply, and this causes deep changes. Vaginal walls become thinner and more fragile, pH levels shift, raising the risk of infections, and blood flow to the area decreases, reducing sensitivity. It's as if a vital part of the body lost its natural defense system. But here's the truth. This does not mean intimacy, pleasure, or sexuality have to end. It simply means your body is asking for a different kind of care, one adapted to this new stage of life. Ignoring this symptom can lead to even more serious consequences. In addition to painful intercourse, known as dyspareunia, vaginal dryness can cause micro-tears that open the door to recurring urinary and vaginal infections. Many women believe they're dealing with recurrent infections without realizing the real trigger is dryness caused by hormonal decline. And the emotional impact goes even further. When intimacy becomes painful, many women start avoiding it, losing desire out of fear, and end up believing that something is wrong with them. This can damage relationships and lead to feelings of isolation. But here's the good news. The right information and action can break this cycle. And the best part is, there are many safe and effective solutions available. The first step is understanding the difference between lubricants and moisturizers. Lubricants work immediately, reducing friction during intimacy, while moisturizers have a longer-lasting effect, restoring natural hydration when used regularly. This simple distinction can completely change a woman's daily life. In addition, lifestyle habits matter too. Staying well hydrated, eating foods rich in vitamin E and omega-3 fatty acids, and practicing pelvic floor exercises can improve blood flow and help naturally support intimate health. We also need to talk about medical options, which are often overlooked. Local estrogen treatments, in the form of creams or vaginal suppositories, can restore elasticity and lubrication to the tissues. For some women, systemic hormone replacement therapy might also be recommended, depending on medical evaluation. And in recent years, modern therapies like vaginal laser treatment have been gaining attention. This technique stimulates tissue regeneration and has shown promising results. The key here is remembering that every woman is unique, and consulting a gynecologist is essential to finding the best solution. Now let's clear up some myths. The first is believing that vaginal dryness means the end of your sex life. That's not true. Intimacy can still be enjoyable and satisfying. Another myth is that dryness comes only from a lack of desire. Again, that's not true. This is a physical change caused by hormonal shifts, not just a matter of will. And perhaps the most damaging myth of all, believing that pain is just part of aging. Pain should never be normalized. Whenever there is pain, the body is signaling that it needs care and attention. And here comes the part 1 promised at the beginning, something that few people talk about. Intimate health during menopause is not just about treating vaginal dryness. It's deeply connected to overall well-being. When we care for intimate health, we're not just preventing infections or making intimacy more comfortable. We're also strengthening self-esteem, rebuilding confidence in our own bodies, and rediscovering the ability to feel pleasure and wholeness. It's a holistic kind of care that involves body, mind, and even relationships. So, the most important message of this video is, you don't have to suffer in silence. There are options, there are solutions, and taking care of intimate health is an act of self-love. If you're experiencing this, don't blame yourself and don't feel ashamed. Seek medical help, talk with trusted friends, share information. The more openly we discuss this issue, the fewer women will feel alone. And before we close, let me leave you with a reflection. How many women around you might be going through this same problem in silence? How many could completely transform their experience with just the right information? So, if this video resonated with you, please like it, share it, and subscribe to the channel so we can continue building a community of support, compassion, and knowledge. Because menopause doesn't have to be a time of loss. It can be a phase of rediscovery and new beginnings.